we're gonna have to keep, and then I'll upload part 2. All right, so let's move along then, so we can try to get through this right here so you can finish going doing your thing as well. Okay, there goes somebody else right there, Mr. Santa. All right, so where were we at, Miss David?
What was the four
All right.
right, the
Okay.
right patient, the right dosage, the right route, the
Mm-hmm.
right location,
Right time. Okay, good. All
the
right.
right
So
time.
the four, I think it's 4 or 5 of them. Maybe one more. Um, I'm trying to see what are the. Let me see if I can Google it right quick because I think it may be one more. Hey Google, what are the 4? Excuse me, 5 routes? Google, what are the 5 routes for patient medication? Not the routes. I'm sorry. Not the routes, but the reason for the 4 rights, the 5 rights. That's what I meant to ask Google. I'm sorry. What are the 5 rights for a patient? Dang it, it's not doing. Hey Google, what are the 5 rights for patient drug administration? Okay, so the right patient, which we said, the right drug, the right time, the right dose, and the right route. Okay, so it is the ones I mentioned already. I thought it was more. I thought it was one more. Okay. So those are right what I mentioned. Okay. I just wanted to double check. I could have sworn. I think one of those books says something else. Nevertheless, all right. So you guys you got an understanding of that at least, correct?
Yes.
All right. And you got to understand then what we said by the trade names such as nitroglycerin, which is the generic name,
Yes.
trade
Yes.
name, nitrostat. Okay. So you guys should have a somewhat of understanding to do your homework at least. Okay.
Yes. He only told us to give two medicines because I called him last night because it didn't on the description it didn't tell us how many, you know.
What you
So
talking
I
about?
on our homework that you're just talking about.
And it's who said what now?
Mr. Walter said only give two medicine names. Only do two. So
Why?
you can do,
Only two?
yeah, only two. I asked him and he said do only two. I called him and I asked him
Why
because
is
he didn't give, huh?
why did he say only 2?
I don't know. I was like, hey, Mr. Walter, you didn't tell us how many to do on the assignment. He was like, just do only two. I was
Don't
like, okay.
that
I
don't
thought I was
make
supposed to
sense.
do all of them.
Yeah, that don't make sense. Do all of them things. That don't make sense to do 2 because he's giving you
Okay.
1, 2, 3, 4, 5, 6 drugs. There's only 6
Yeah,
drugs there.
and that's why I told him, but he was like, dude, I think he was trying to rush me off the phone. I don't know.
Listen, do all of those drugs, okay?
Okay.
Don't just do 2 of them. That doesn't make any sense. Okay.
Okay, because I turned in two last night and I already uploaded, so I just turned in the rest of them.
Yeah. All right. That
Okay.
because he may come back tomorrow or I mean Monday and be like, what is this right here? And be like, well, you told me to do 2. So just do all of them because that just like I said again, that doesn't make any sense. But anyway,
Okay.
so yeah, so now your you got your epinephrine, you got your aspirin, activated charcoal. All right, so we'll talk about those once you guys do the thing for those as far as your contraindication doses and so forth, and we could elaborate in class on what those other drugs do. Okay, so let's talk about that Monday when we get back in class, since I've already given you one. Now, since you all are going to Airway, right? Uh, Airway and breathing, if I'm not mistaken. Is that right? Airway and breathing. I think that's what you guys getting ready to start on. Airway management, right? And we
Yeah.
talked, yeah, and we talked about airway and management a little bit. You wasn't there, Miss Davis, but we started talking about airway management in class a couple of days ago, right? And we gave some examples. Now, one of the things that you need to know is you need to know the anatomy of your airway, okay? You need to know the anatomy and physiology of the airway. You need to know the difference between the upper airway and the lower airway. Okay. You guys remember we talked about that one day in class?
Talk about what one day? You repeat?
The upper airway and the lower airway.
Yeah, I think it was Wednesday, maybe.
Okay. Yeah, we did a little something on airway, but prior to that, we went over some slides one day about upper airway and lower airway, because that's when you guys learned about nasopharynx, oropharynx, laryngopharynx. Does that ring a bell?
Somewhat.
Okay. Well, it needs to be ringing more than somewhat, okay? Because you guys need to know in case you see questions on it. All right. You have obviously your upper airway, which consists of your nasal cavity, right? Your hard palate, soft palate, tonsils, oropharynx, obviously the tongue, vallecula, all right? And then the laryngeal pharynx is where you're getting ready to go split into the lower airway, all right? So when you start getting to the lower airway, you start getting towards the epiglottis, the vocal cords, trachea, and things of that nature, okay? But right now, we're dealing with the upper airway. All right? So you need to review upper airway. All right? So ventilation, we talked about ventilation, breathing, respiratory, and gas exchange. Do you guys remember when we talked about gas exchange and how gas exchange works in the body? What does gas exchange work? I specifically went over this with you all, so you guys should remember this. How does gas exchange happen in the body? By what means?
Diffusion.
Diffusion. Good job, Ms. Dow. Exactly, by diffusion. And does it go from an area of lower concentration to a higher concentration, or from an area of higher concentration to lower concentration?
High concentration to lower concentration.
All right, good job, Ms. Davis. Good job. Exactly. Okay. Now, let me see if I can show you. Hopefully I can share my screen here. Can I show this? External. Let me go to my channel here. Channel button. Home page. I need to get to the home page of this thing. Okay, YouTube. There we go. So let's see if I can show you this right here and show you how that works when it comes down to external and internal respirations. Okay. So let me see, what does that say? That says external. That might be it right there. Gas exchange, external and internal respiration. Simplify, is it? Okay. Let's see, this might be it here. Okay, is this it? All right, so this might be it here. All right, I think this is it. Hold on. Commercials.
I was 17 years old when I took over my family's small farm. Today, we've...
All right, here we go.
This is a view.
All right, here we go. So let me see if I can share my screen. All right, share screen. Let me see, share screen. Okay, there we go. Where am I at here? Is it right here? Yeah, this is it right here. Share. Okay, can you guys see that?
Yeah.
Yes.
Right. Okay, so this is going to be external versus internal respiration. Okay? And the gas exchange. Let's see.
Your request video. It's on external and internal respiration.
I'm going to move it fast forward some.
The outline to this is first out, and that's why we breathe out CO2.
Here we go.
So hopefully O2 is heading into the cat.
All right.
Oxygen flows through.
Here we go.
And continue. And that same exact idea of oxygen in the blood flow from the in here, the alveolus back here, that's the blood flow going down this way, the oxygen value. All right, so
External
let's look more
respiration, okay?
specifically at external respiration, which is at the alveoli. If we take a little piece of the alveoli with the capillaries surrounding it and we zoom in on it on this picture I borrowing from Pearson here, you can see that there is blood flowing in on the capillary and it has these partial pressure numbers, and then the alveolus, a little section of it right there with this partial pressure of their gases, and then the partial pressures over here. What we need to do is isolate each gas one by one. So we'll look at the oxygen values. As blood is returning back to the lungs, it has a partial pressure of 40 millimeters of mercury, mmHg. The alveolus has a PO2 of 100, and after it leaves the alveolus and starting to head back to the left atrium, it has a PO2 of 100. So let's make a little simplified diagram of this. All right, so this at the bottom, I'm showing you the blood flow direction and the capillaries. If you look back here, that's the blood flow going down this way.
Okay, pay attention to this part.
The PO2 is 40. Again, looking back here, you see the PO2 of 40, the PO2 of 100, and the alveoli is the same, and then PO2 100 after release. I drew this here because, again, what type of epithelial membrane do we have here for the alveolus and the capillaries? Is it columnar? Is it cuboidal? Is it strat?
All right, so you guys see this part right here, what he's talking about, right? What is this considered? This is the alveoli, right?
Yes.
Yes.
Yeah.
So this is an example of the little grape looking things that are in your lungs. But right around it, that's running across it, there is your capillaries. Okay, so here he's going to show you an example of things from a higher pressure moving over into here to a lower pressure, and it's continuing on throughout the body. Okay, so let's continue to listen and see what he says.
Stratified squamous. No, hopefully remember, it's simple squamous. It has one layer of flat cells, such as the endothelial cells right here, the blood vessel, and around the capillary as well too. Okay, so this is what we're going to do here. We're going to show blood flowing in here. The red dots, if you look at the bottom left, represent the oxygen. So we have a relative pressure of, or a partial pressure of 40. In the alveoli, it's higher at 100. So what we need to do now is compare the partial pressure of oxygen in the alveoli to the partial pressure of oxygen in the blood flowing from the capillary towards the alveoli. So let's remember back to what we just did about diffusion. We had side A and we had side B. Which side had the higher concentration? Well, side A. And again, it's going to flow from low to high or high to low. It's going to flow from high to low, so from side A to side B. And that same exact idea now, when we go back to the alveoli into the capillaries, so which way is it going to flow? From the alveoli into the capillary? Or is oxygen going to flow from the capillary into the alveoli? Well, where do we have a higher partial pressure? Look at the alveoli, we have a PO2 of 100. And then over at the capillary, we have a PO2 at 40. So as the blood flows by, oxygen will join from the alveoli. Again, I'll repeat it once more. Oxygen flows through and continues to oxygenate the rest of the body as it returns to the left atrium. And as you see, we have homeostasis, which means we have a balance now of the PO2. And that's how it equilibrates, how it knows that's enough, is because it's going to match. We have 100 here and we have 100 over there.
Now, does that make sense to you all, what he just said?
Yes.
Okay, because I want you to understand this is how the pressure is moving in as it relates to diffusion, or the gas exchange in your lungs is happening. So when you take that breath, those little dots, that the blood cells that are traveling through your body, it has to have a higher form of concentrations, and so that air is being moved across that permeable membrane, and it's equaling out from a higher level of concentration to a lower level of concentration. okay, equaling itself out to be continued to be transported throughout the body. So that's going to be external respirations because it's coming from the external environment into your lungs. This is where the gas exchange is happening, and then it's being moved and transported throughout the body. So let's continue to hear what he's saying since you guys got that.
So that's why when you look at this diagram, O2 is heading into the capillaries over here. Okay, let's try CO2 now. So we need to take the values of CO2. You can see the 45 as it's approaching the alveolus, the 40 in the alveolus, and we change the gases. The legend's at the bottom left corner of this screen. So hopefully by now you're starting to get the idea. Where do we have a high concentration of CO2 and where do we have a low? Well, the blood flowing towards the alveoli, as you can see, it's higher. The concentration of CO2 in the alveoli.
I might have jumped ahead. I thought I was on that previous screen. Now, this is where your CO2. Now, what did we say in class what CO2 was?
Carbon dioxide.
Carbon dioxide, meaning it's like a waste, right?
Yeah, it's what comes out of our bodies.
Exactly. It's what you breathe out, right? Now, look at this right here. You see, now it's higher on this side than it is on what's in the alveoli, right? So when you breathe out, the carbon dioxide that's in the blood cells will now merge over here more because you don't have as much in the alveoli. Now, once it merges over here, where do you think that's going? Is anyone there?
You said when it goes where? I didn't hear the question because my son was yelling. I'm sorry.
Where does this carbon dioxide go once it goes in here and it diffuses through here? When it goes from the higher concentration to an area of lower concentration, once it's in the alveoli, where does it go after that?
It goes,
I can't hear you. One at a time. Say what now?
Miss Davis, you can go. I'm sorry. No, you can go, Miss Davis.
No, you good.
No, I was just gonna guess because I felt like once it left the alveoli, I didn't hear it on the video. I think he said it goes into the bronchioles.
No, this is in your bloodstream. This is carbon dioxide. You guys are saying it, but you're not saying it. We just said it a few minutes ago, right? So you got this part right here, which is a level of higher concentration going into a level of lower concentration, right?
Right.
This is waste, right? What is the alveoli connected to?
It's connected to, it's in the lungs, so
okay,
connected to the bronchioles, though.
Right. So if it goes here and now it's being transported, and we said CO2 was waste, then where is it going?
It's going out. We're exhaling it.
Exactly. That's what we're doing. So let me let you finish watching it now that you got that.
Alveoli is lower. So what's going to happen? Well, as it flows by, CO2 is going to enter into the alveoli, and then we're going to breathe it out. And that's why we breathe out CO2 versus O2, which we breathe in, and we're going to have homeostasis at the end. It's going to match its number, 40 and 40. So the partial pressure changed about 5 millimeters of mercury. Now, hopefully this diagram is starting to make a little bit more sense. As you see here, the PCO2 is 45 and it's 40. So we're going to go from high to low. And that's why you see this green arrow, or the arrow here, showing you that CO2 is going to the alveolus in order to be exhaled. And then it's going to change this down to 40. So there's a drop in 5 millimeters of mercury. So realistically, what's happening? Well, both of these are happening at the same time. So you'll see O2 come into the blood and CO2 leaving the blood and going into the alveoli. And it's going to continue. The CO2, some O2 will be exhaled, but the majority of the O2 will come into the blood. So just one more time, there's going to be a change in diffusion across the membrane of both gases. And so external respiration, both O2 and CO2 are moving together, but in opposite directions.
Okay.
Now, internal respiration should be much.
Now, here's going to be internal respiration. Now, you saw that process on external respiration. Let's see what internal respiration looks like.
It's easier to understand once you understand external. All you're going to be doing is reversing the flow or the pathway of both the gases. So again, internal, what does it mean? Internal means at your body tissue cells, such as your myofibers, which are going to be your muscle cells that you can see over here, your adipocytes, your fat cells, other epithelial cells that could be in there, cuboidal cells, whichever, anything basically in the body other than your lungs, immune cells as well, and again, lots of other cells in the body.
Basically, your tissues.
So here's a question. Why does oxygen diffuse into the tissues as blood arrives on the capillaries? And what is the change in PO2 of the blood as the capillaries leave the tissues? Well, of course, try to pause this and think about it, but I'll continue here. Well, the first part, why does oxygen diffuse into the tissues as blood arrives? Well, let's look at our values. We have a 95 up here. We have a 40 there. We have a 40 down there at the bottom. The first two ones are the more important ones. We have 95, we have 40. And what's the rule here? Well, diffusion. And diffusion, which way do solutes move, or gases, for example? From high to low. So that's why we go from our 95 to our 40. And that's why you see this arrow here, why oxygen enters into the tissue. And we continue. What is the change of PO2 of the blood as the capillaries leave the tissues? Well, the PO2 is 95 here and 40 here. We do a little math, so there's a difference of 55 millimeters of mercury. So you can do the same thing with CO2. As you would see, there's 40 over here and there's 45. So we're going to go from high to low CO2 partial pressure concentration. So that's why the CO2 is going to enter here into the capillary to return back to the right atrium, and then eventually the lungs to get more oxygen. And to
all right. So you can see here where internal respiration is happening in the tissues, because your tissues is being facilitated by also oxygen as well. The oxygen that your tissues is receiving is coming from your blood cells also. You see what I'm saying? But the tissue has to release CO2 as well, or waste, and it has to dump it into the bloodstream. Once it dumps it back into the bloodstream, it goes back around to get facilitated to have oxygen dumped back on it. So it comes back around once again and then get uploaded to the tissue. You see what I'm saying? In the same diffusion process, but that process is called internal respiration. So you need to know the difference between those two. Does that make sense?
So one was internal and the other one was
external.
External is when we exhale and we're breathing in and out, and it's the CO2 and the oxygen flow. But internal is when you're saying it's going through our tissues.
No.
And we're doing the same thing.
Yes. Internal is when it's going through your tissues.
And we're doing the same thing, but it's releasing CO2 back into the bloodstream versus outside the air.
Right. CO2
and then it's recycling.
The tissues going back into the bloodstream or back onto the cells. Right.
So that's the difference between internal and external respiration.
Exactly. And the external is how anybody.
How we breathe. How, like, when we breathe in oxygen and then we breathe out CO2, the waste. That's external.
Right. But how's it happening within the cells?
Our red blood cells are bringing in the oxygen.
Okay.
And then it's going through the fusion in the body, through the alveoli.
Okay, good.
And then the alveoli releases the CO2.
There you go. Good job. That's the difference between internal respiration and external respiration. Okay. All right. So that's a good starting point for you all. The next starting point, I'm gonna jump off of this right here. Stop sharing. Okay, good job, Ms. Dow. All right. So that, along with knowing
Thank you.
Yes, knowing your upper airway from the lower airway. Okay, lower airway is the lower airway begins at the glottic opening. Okay. So just know everything from the glottic opening up is the upper airway, and everything from the glottic below begins and proceeds into the tracheal. Okay. The tracheal is formed up by 20 rings of cartilage, beginning with the cricoid ring. Okay. So everything above, or excuse me, it says the lower airway begins, of course, at the glottic opening. All right. Everybody know what the glottic is, or epiglottic?
Glottic is the epiglottis.
Right. That's where the
Okay.
lower airway starts. Okay, or
But
laryngeal pharynx.
and you said that it's by the tracheal, the C one, the part.
Tracheal is below that. Okay.
So that's the tracheal. Is that the midline of our airway?
Well, the laryngeal pharynx would be considered the midline of the lower airway, between the upper and lower. Okay.
Okay.
But you can say epiglottis and vocal cords because they are in the laryngeal pharynx area. You see what I'm saying?
Okay.
Right.
Okay.
So everything below that is considered the lower airway, and everything above it would be considered the upper airway. So I'm going to ask you guys a question. Okay. Anybody can answer. If I say, is your nasal pharynx in the upper airway or lower airway? You would say
In the upper.
that exactly be upper. If I said that the oral pharynx is in your upper or lower airway, you would say what?
What'd you say?
If I said that your oral pharynx is in your upper or lower airway, what would you say?
In our upper.
Exactly. It's in your upper still. All right. Now, if I said that your bronchioles is your upper or lower airway, what would you say?
Lower.
Lower. If I said your tracheal is in your upper or lower airway, what would you say?
Upper.
Nope. Tracheal is below, or it is after your laryngeal pharynx area. So it's below the epiglottis and it's below the vocal cords.
Okay, yeah, that's where I got it confused. I mean, I can see it on the body. But our vocal cords are above our trachea because it's like closer to the Adam's apple.
Right. So I need you guys to commit that to memory because you may see that on the test.
So tracheal is in lower.
Tracheal will be considered lower airway. Right.
Okay.
Okay. All right. Let's see. All right. So, okay. I think we got 10 more minutes here. Yeah, 10 more minutes. Okay. All right. So does that make sense?
Yes, it makes sense. So we're going over external, internal, and upper and lower airway.
Yeah, because you guys are getting ready to go into airway management starting next week.
Okay, so we're okay.
So we just kind of doing
that.
Yeah, so we just kind of doing like a preempted strike or preempted study session, okay?
Okay.
Okay. All right. So now let's talk about let's see. Upper airway, nasal pharynx. We said some of that.
Okay.
Hmm?
Bye, y'all.
You going to the game?
Yes.
All right. Well, y'all be safe, man. Have
See
fun.
you later.
See you later. Good job, Miss Dow.
Make sure you get that
Good
home.
job too, Miss Davis. I'll see you on Monday.
See y'all on Monday.
Okay.
Okay, be safe.
Okay. So certain degree, let's see, lower airway. What else were we going to talk about as far as the airway? We talked a little bit about gas exchange, which is good. Ventilation. Oh, this is a good one here. All right, so alveoli ventilation, all right, is the volume of air that reaches the alveoli in 1 minute. Okay, so it is a function of both respiratory rate and tidal volume. All right, the tidal volume is the volume of air inhaled and exhale in one single breath. So this is something that you got to know. Tidal volume is the volume of air inhale and exhale in a single breath. Okay?
You said that's called tidal?
Tidal volume.
Like TIDAL?
Uh-huh.
Oh, so wow, that's crazy. That's a music stream. Tidal volume. It got something to do with the sound. Okay. Tidal volume.
Not the sound. It's the volume of air introduced into your airway in one single breath.
Oh, like the volume of the air in one single breath that we take. It's called the tidal volume.
Right. Tidal volume is the volume of air inhale and exhale in one single breath.
Okay.
All right. It's the tidal volume can vary depending on the size and respiratory pattern of the patient. All right, but approximately 5 to 7 milliliters, all right, of per kilogram of body weight. So in actuality, for an average person size, all right, you guys need to write this down. For the average person, it's going to roughly be about 500 milliliters. Okay, for purpose of discussion, normal tidal volume for an average person size is about 500 milliliters.
And that's a person like an adult?
Right, normal, yeah, normal adult. Okay. Does that make sense?
Yes, it makes sense.
Okay. All right. Now, we talked about tidal volume. Let's talk about minute volume. Minute volume combines tidal volume and respiratory rate to measure the volume of air breathed each time. All right, I'm going to say that again. Minute volume combines tidal volume and respiratory rate. So respiratory rate and tidal volume, all right, equals the amount of breath breathed each time, which is known as minute volume. All right, you probably need to see that somewhere and read that as well. It says, but measurement of minute volume does not ensure that air has reached the alveoli. It's of the 500, now this is something you definitely need to write down, of the 500 milliliters of tidal volume, because we said that that's what normally it is for an average adult patient, about 500, but all of it doesn't reach the alveoli, okay? Typically, only 350 milliliters may reach the alveoli. The remaining 150 milliliters of air occupies space in the tracheal and in the large bronchial tube and never reaches the alveoli. This is called dead space. All right. So I won't move on more than that. I just want you guys to get this, and then we're going to call it, because this can get a little, mind-boggling a little bit for some. Okay. So total tidal volume is roughly how much for an adult patient again? Hello?
500.
Okay, good. 500, right?
Milliliters.
That's right. 500 milliliters. Good job, Ms. Dow. Okay. All right. Minute volume consists of tidal volume and respiratory rate. So the tidal volume plus respiratory rate. So normal respiratory rate is about, 12 to 20 breaths per minute. Okay. But we're going to say minute volume combines tidal volume and respiratory rate, and that measures the volume of air breathed each time. So just think about it. How deep you breathe and then how many times you breathe. That's what's going to equal up to your minute volume. Okay. But out of that minute volume, all right, not all of that 500 milliliter meets or all gets all the way to the alveoli. Some of it doesn't reach there. So out of that 500 milliliters that we said, typically only how much reaches the alveoli? What did we say a minute ago? How much reaches?
350. 350 milliliters.
Good job, the 350. So that leaves you about how much space or how much air left that didn't make it to the alveoli.
150 milliliters of dead space.
Yeah. Hey, there you go, Ms. Dow. Perfect. That you got it. That's it right there. Okay, does that make sense to you, Mr. Santa?
Yeah, it makes sense, bro.
Okay.
Yeah, it does.
All right. So you got to remember, if somebody said, if they had a question on the test says, what is dead space considered? You would say it's the amount of air that doesn't reach the alveoli that's left in the dead space or left in that space.
Right. It's usually 150 milliliters.
There you go. You see what I'm saying?
Yeah.
But you wouldn't know that unless you read this.
Right.
Right.
You see what I'm saying? This is why it's so detrimental for us to be studying, for us to be reading, because I'm not covering all this here in the chapter when I'm doing my lectures.
Right.
You see what I'm saying? But if you didn't understand it when you was reading it, you would have to write that information down. When you get to class, we would cover it, and then you would see now, just as we're explaining it to each other here, you would get an understanding just like you got the understanding now.
Right.
You see what I'm saying?
Yes.
That's why we need to be reading and studying. Okay. So I think that was good. I think that's good right there, what we talked about. We did a little bit of the pharmacology a little bit, kind of explain some of those things. You guys got a fairly decent understanding on that, correct?
Yes.
All right, good. And then we just kind of touched the airway and breathing a little bit. So I think you guys got a pretty good, fairly decent understanding of that as well, at least for an introduction somewhat, okay?
Yes.
And then we'll get into like upper airway problems when we get back to class, lower airway problems, ventilation problems. We'll talk about some of those things when we get back to class, okay?
Okay.
I got a question.
What's it? Go ahead with your question.
So
right.
I'm sick. So do I still go to clinicals or like I can't?
If you're sick, you need to make sure you let Ms. Brandy and Mr. Corbett know. Of course, Walter's your main instructor, mainly your main instructor, but you might want to mention it to Brandy as well, because she's the clinical coordinator.
Okay. All right.
Okay. All right. Any more questions?
No, we're pretty straight.
Okay.
Thank you for the thank you for this though.
No, thank you for the study session. I appreciate it.
Yeah.
I'm about to go to my kids' class football
Okay.
game. So I appreciate it.
All right. Sounds